It has been 1 year since the Public Health Insight launched our podcast in March of 2020, and we're excited to celebrate this incredible milestone with our followers in 1,500 cities in more than 100 countries who have supported us along the way. We couldn't have done it without you. My name is Gordon, Executive Director of the Public Health Insight, and your host for this episode, and I will use this opportunity to take you on a walk down memory lane as I recap on some of our favorite moments from our most popular guests in 2020.
This is the Public Health Insight Podcast.
In episode 6, released on April 10, 2020, Dr. Thane, Deputy Head of the General Practice Department in Cayman Islands, joined us to discuss some of the challenges for the healthcare system during the initial stages of the COVID-19 pandemic and some of the psychological impacts on healthcare workers. In this clip, we asked him about COVID-19's disproportionate impact on long-term care homes, the consequences of the healthcare capacity being overrun, and he also stood out for his simple but eloquent answer when asked about the competing interests of health and the economy.
I think we've been caught napping. And for that, I will probably ascribe some blame to our neighbors in North America. The entire hemisphere takes its cue from what happens usually in the US. If the US is vigilant about something, we tend to pay attention to it. If they're not, then the urgency seems to be a little bit less. So I think the stance that was taken initially in dealing with it from the point of view of the United States sort of set the tone for the rest of the countries in the region. And so we're playing catch up. Some of us are catching up a little bit better than others, but by and large, we're playing catch up.
Right.
Speaking to that, with the lack of life-saving healthcare resources, as like many preventable deaths are occurring simply because there's not enough space. So from your experience, I'm wondering what toll does this take on decision makers in healthcare?
It's a huge toll. Remember, we've been trained, we've been sworn to our oath to do no harm. Also, we try our best to see that no harm is done. When you have patients of the volume that they're coming in, and I'm speaking of what we see going on globally, it's difficult as someone who tend to life to see so much death happening around you, and it wears you down.
Yeah.
Right.
It does wear you down.
I think a lot of the responses coming globally, or especially in the US and Canada, they're very much weighing a couple of options. For example, they want to make sure the health of the population is optimal and making sure everyone's healthy and protected, but at the same time, they're also concerned about the economy. So what's your view on that? How do you balance that appropriately?
You can resurrect an economy. You can't resurrect a person.
In episode 9, released on April 21st, 2020, Dr. Sajjad Fazil, a public health researcher, joined us to talk about the rapid propagation of misinformation on the internet and on social media and how it can impede the progress of important public health measures. In this clip, we talk about the how, what, and whys of misinformation and social media as both the problem and the solution.
There's two sets of things. There's one that the spread of misinformation is deliberately spread by people who gain from it in one way or the other. And then there's the other aspect, which is the public and somebody else who just forwards as received or just shares a post that somebody sent to him or tagged him on. And I think one of the ways to actually stop the spread of misinformation, and one of the messages that we need to get out to the public, is do not forward as received, do not share the post that you get. Have a look at it, read it, fact check it against websites, and then share it if it's accurate, and if it's not accurate, just delete it. And if you don't mind, I'll actually share this. So there's a study been done by Dr. Gordon Pennycook who is studying misinformation and looks at the psychology aspect of it. He coined, and there's this word that they use, it's called cognitive miser. These are people who have the intelligence to differentiate between accurate and inaccurate information, but they just share it. There was a study that found that that looked at fake news and stuff, and 25% of the people in that study thought that the fake news was true, but 35% of the people shared it, which means 10% more people shared it despite knowing that maybe this is not true. And you see different studies looking at a variety of things. For example, if you share something, any statement, and then you have an image attached next to it. So if you see something about COVID-19 and you have a picture of the virus, people are more likely to think that that information is true. Similarly, if you repeat statements within an article, it's more likely that somebody thinks it's going to be true. So there are these things that people who propel misinformation use, and I think we all have to be careful and stop and think and say, wait a minute, is this true? Am I sharing something because it's true? Oftentimes people, when they share something, they say, oh, this is going to help somebody, or this is going to benefit somebody. Well, it might not benefit him, and actually might cause detriment to him if what you're sharing is false.
Some research studies have shown that there are many cases where false information is spread more quickly than the truth on social media platforms. And we also know that a lot of public health measures use social media platforms as a means to reach the public. Which leads me to the question, is social media our friend, our enemy, or somewhere in the between, like a frenemy?
Yeah, great question. I think I'd go with frenemy, and I'll tell you why. The way I look at social media, it's a tool. It's a tool that can be used in the right way or the wrong way. You can use a car to take your friends out to the mountains. Well, not in this time, but yeah. And you can use a car to run over people, right?
Right.
And we know of both instances in Canada. So I think it's a tool just like any other, and it's how you use it. Yes, it's true that misinformation spreads faster than accurate information. And I think, and you have come to a very important point that I wanted to discuss today, it is, how can we improve health communication? I mean, when I look at things and I say, wait a minute, doesn't this show that there is a gap in the way we communicate to the public? Doesn't this show that we need to improve our game, so to speak, as public health professionals when we educate the public? How many public health units in Canada have a social media account on Instagram? How many public health units use memes? Why can't we use memes? Today I made a nice meme about COVID-19 misinformation. and I mean, the state of Ohio, their Department of Health, have you seen the video they shared about social distancing?
No, we haven't.
Yeah, so I'll tell you, I'll just describe it. It's a room. The tiles are black in the room. There's mouse traps everywhere. I'm trying to make it descriptive so you can imagine it. There's ping pong balls on the mouse traps, and the mouse traps and ping pong balls are kept quite close together. All the mouse traps, and then somebody throws a ping pong ball, and it hits one of the mouse traps, which makes that ping pong ball go all over the place, and it continues. Right? And then they do the same thing, except this time the mouse traps with ping pong balls are kept separately, and when the guy throws this one ping pong ball, it goes in between all those mouse traps. And then they just say social distancing works.
Yeah.
Beautiful message. It went viral on social media. Now my concept, my personal philosophy is, let us make public health viral. Why not? Why can't we collaborate with celebrities who are ready to collaborate with public health and help spread the message? Why can't we work with media companies that do advertising for some of the biggest companies like Coca-Cola, PepsiCo? I mean, some of these companies, if you see their ads, they always go viral. It's because they work with marketing agencies that have a pulse with the public, right? They know what's trending, they know what's going on. I don't think it's effective anymore to put up a billboard and say smoking kills. It's probably not as effective to say, let's say, the younger demographic than having a meme about it, or having a Twitter post about it, or an Instagram IGTV video. So I think the way we look at health communication is important.
In episode 11, released on May 1st, 2020, Jessica Schill, a policy advisor with Beef Farmers of Ontario at the time, joined us to talk about how the pandemic has impacted food security, food production, and how it affects our health. In this clip, we ask her about how technology can be used to support the agricultural industry and the current level of uptake with workers in the sector.
In terms of automation and tech in agriculture and even in the food supply chain in general, I know by primary producers, it's 100% welcome all the time. They love the idea of new technology because ultimately it helps them to be more efficient in their production, which is the goal, right? To be more efficient and produce better quality food all the time. And they want to make sure that they're producing the highest quality of food for our consumers. So talking about that, there is a lot of technological advances that have already taken place or are already in the process of happening, especially in Canadian and US agriculture. So for example, our planters, our corn planters, they're automated. So for example, instead of overplanting a row or something like that, the planter knows how many rows to plant and it will shut off its planters if it gets too close to another row. And the producer can decide how far apart he wants things so that he can make sure he's fitting the ultimate number of plants in that field to grow the best yielding crop. So basically, they're always using technological advances like that. Another one being in our sprayers. So a lot of sprayers, they're self-propelled now, so they can actually shut off the sprayer tips as they're getting close to the edge of the field, or if it's going over a spot that it's already sprayed, it'll shut off the tips so that they're not overspraying or anything like that, which is really cool because, they're not wasting anything and they're doing the best they can for the crop and the soil health, which is really awesome. And then another kind of automation is now they have GPS software that can connect you to at home. So, for example, a producer's out in the field planting, he can see his maps can be downloaded to his phone or his MacBook at home, and he can see where he's planted and what's been planted there and really take a good look at things from home. And then that system will also allow the parts servicers to come over into their tractor and service the equipment, not like remotely. So they don't have to go into the dealer, take the tractor in. It can all happen in the field while they're still working, which is really helpful to continue, producing and being efficient in time and not having to take an entire day to go into town to get your parts and stuff. So yeah, there's definitely a lot of advances, and with those advances is also coming there's going to be a lot more jobs in agriculture as well, and food supply, because they're going to need people to troubleshoot and IT and tech to support these advances. And we are seeing that shift now with a lot of people studying different agricultural tech products and being involved in that way. So it's definitely a sector. Agriculture is a sector where there's lots of room for growth with tech and advances, but it's definitely started. The ball's already rolling, which is really cool.
In episode 22, released on July 14th, 2020, Rose Marcellin, a public health researcher in the United States, joined us to talk about the benefits of integrating cultural competency in the healthcare system. In this clip, Rose talks about the difficulties racial and ethnic minorities experience when navigating healthcare services and the need to address language as a barrier.
Cultural competence is the ability of providers and organizations to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of patients. And when I think about that definition, I know often, when we think about cultural competence, you just think about the social and the cultural piece. And I think we sometimes neglect the linguistic needs of patients as well. And so I was kind of reminded a little bit, a couple years ago, my mom, so I'm Haitian, she's Haitian, she speaks Creole, and, she speaks English, but the proficiency is not always there. And so she was going through some medical issues, and I was here, and I said, I'll go with her. Just because I know while she might understand the gist of the conversation, sometimes the nuances that goes into your medical appointments might get lost in translation for her. So I was able to go with her just to make sure that I knew what she was supposed to be doing, right? And then also just to have, someone there, if she had questions, I can kind of help make sure she was able to articulate what she wanted asked. And I think about what that experience must be like for her, where, she's at a point where she knows she needs to go to the doctor, but there's this kind of concern in the back of her head that she might not understand fully what's happening. So it goes back to this linguistic needs of patients and how do we incorporate that in healthcare settings. I think the ideal, of course, would be that every provider or every facility will have interpreters and things like that, but we know that's not the case. So how do our healthcare systems, better prepare and engage with their patients that might have social and cultural differences from the norm? And I'm using air quotes around the norm, but you know what I'm saying there.
Yeah, and that's a good point also, Rose, because linguistically it's very important in terms of someone can go to the doctor, get treatment or get medications if they're sick, and if they're able to afford it because of healthcare or prescription coverage, the next place they're going to go to is the pharmacy. So when most pharmacies are printing labels in English and predominantly have pharmacists who maybe only speak one language, which is English, then it extends beyond the immediate healthcare primary care setting to other peripheral and supportive parts of the healthcare system. Because if this person sees a doctor, gets the appropriate medication, then it's another thing in terms of disease management now with the pharmacy, right? Because if they are not able to comprehend the instructions with the linguistic piece that you mentioned, then they're not going to be able to keep their condition under control, and then this is going to put even more pressure on the healthcare system when that person is readmitted. So I wanted to emphasize that as well.
Yeah, that linguistic piece, I think, is so often neglected. I think sometimes when we are looking at whether it's just health messaging or sharing health information, even going beyond the linguistic to include like plain language in how we disseminate health information. But I'll take it back to the linguistic piece. Just for example, I know in urban and culturally diverse areas that you will find health information or even the pharmacist labels on your prescriptions or the little information sheet will have multiple languages on there. So I know in Miami, for example, where I was raised, like I know when my mom would go to the doctor, she would get the information sheet oftentimes in Haitian Creole. Now she lives in Gainesville, Florida, and that's not happening up here. But there are places that are definitely understanding of, who their populations are and who they serve, and they do a better job of meeting some of those needs.
In episode 24, released on July 28, 2020, Linda Holbrook, a public health researcher, joined us to talk about the social determinants of health and why they must be considered in order to improve the long-term health and well-being for individuals and populations. In this clip, Linda challenges the notion that race itself should be considered a social determinant of health. This take was such a good one, we eventually invited her to be a regular on the show.
For me, when I think of the social determinants of health, I like to first start with how health has normally been conceptualized, kind of the traditional or historical definition, where it was more so just a biological thing or genetics. So it's like there's something wrong with your body, you take this medication, and then you're fixed, your problem is solved. But the social determinants offers a broader lens, and these are factors that are beyond just genetics and biology. It's more in regards to the social and economic factors. So things like your environment, your education level, income, even things like racism, all those can impact your health. And if you want to talk about the causes of the causes, and this may be more of a semantics issue, but I think that to say race is the determinant of health is incorrect. And, so many, the Canadian Public Health Agency and others will say that race is the determinant of health. But to be Black or Latino or Asian, like that itself is not a risk or protective factor. I would say it's like racism is the determinant of health. It's that structure of inequity and hierarchy that our society has created is the determinant of health. And so sometimes it gets tricky because we'll see statistics that say, Indigenous people are this and Black people are this, and these groups have higher rates of this disease than that, but we don't say why. And so it kind of creates that narrative of, oh, if I see somebody from this ethnicity, I'm just going to think they're more, it reinforces those biases. And so I think that's something as a public health community we could try to work towards. Instead of pathologizing a race, we talk more about the system of inequity.
In episode 32, released on September 22nd, 2020, Nicole Vick, a public health advocate, TEDx speaker, and author of the book titled Pushing Through, Finding the Light in Every Lesson, joins a podcast to highlight education as an important social determinant of health. In this clip, she shares her lived experience with the lack of diversity in post-secondary institutions.
I'll talk a little bit about my experience, which was so long ago, over 20 years ago. It's okay. But I think it will actually make a lot of sense because I'm starting to see now a lot of colleges and universities sort of kind of come to terms with their own historical past and some of the things that they've done to, either on purpose or on accident, sort of create this difference in experience for Black students and other students of color and everyone else. So I walked onto the campus of the University of Southern California as a freshman back in 1996. I used to live probably 5 minutes away from campus my entire life. I grew up around USC. We went grocery shopping across the street from USC. So USC was very close, but it was yet far away. It felt far, unattainable, because I didn't ever see anybody that looked like me on that campus, as close as I was to it in my entire life growing up. Somehow, and I always say somehow, but no, the reality is I did work hard, applied like everybody else. I got into school, right? Yay. But I felt out of place. I felt unprepared. I felt like this school is not built for me. It is not intended for me. I know the school was built in like 1880 or something like that. And back then, were they thinking about this Black girl from South Central walking on in this campus? No. So the school, by its nature, was not intended for someone like me. Add to that, I was pregnant. I was a teen mom, trying to navigate college. And so it was really hard. There were things like the Black Student Union and things and they offer support. But you walk through campus, the people, the names on the buildings and the photos and the statues. No, they're not Black folks. Not saying they should be, but it just didn't feel like there was diversity. And so
you didn't identify with the place as much.
Right. And so fast forward 20 years later, starting to see the university. And again, I'm picking on USC because that's my experience. And I'm sure others can speak to their experiences. 20 years later, fast forward, they're talking about, we might want to rename this one particular building because he was a former president of the university, but he was a supporter of eugenics. What? Why are we just now talking about this in 2020? It's almost like Black Lives Matter and all of the things that we have to do. We have to act up and act out collectively in general before people start to think about changing things. Oh, let's change the name of the Washington Redskins. How long have people been asking for that kind of stuff? Right? So it was just ironic again in 2020. I've been out of school since the year 2000 and felt out of place back then. And now, maybe we should think about how we treat our students of color and how to make sure that our campus is more diverse. You think so? Why now? Why not 20 years ago, 30 years ago? And I think it really does have an impact on the quality of the person's experience on campus, whether they get out on time or at all. As far as graduating, I was told to take a leave of absence when I said I needed help. I need help. I'm pregnant. What do I do? Well, maybe you should just, take a leave of absence. Why? Why are you trying to tell me if I take a leave of absence, what is the likelihood that I'll come back and graduate? Very low. So why aren't you helping me and helping me find resources instead of just telling me to take a leave of absence? In elementary school, all my teachers were black. The principal was black, everybody black. Okay. And I went to a private school, a parochial school is actually the more correct term. Junior high school, nice mixture, right, of black and others. Got to college, got to USC. I can remember one, and the wonderful thing is I actually still talk to her today. She actually lives down the street. Found out. I said, "Hey, I think that's Dr. Lewis." And walking her dog. I'm
That's
like,
awesome.
wait a minute. Graduate school, zero. Zero black teachers. So, to your point, Linda, really important to me that there is that diversity on these college campuses. And I talk to my undergrad students, and when we have our little section on education as a public health issue, I also ask them that very same question. And there's always at least 2 or 3 that say, "Nicole, you are my first black professor," or black teacher, period. And I'm like, are you serious? And that's why I feel like it's my responsibility to give the Black Girl Magic version of public health, and weave in my work experience, which is amazing, but also my lived experience as a teen mom, for example. Like, hey, that happens in urban communities. And I'm still here. She's here. She's 23 years old, but she was born 8 weeks early. And we could be talking about her as an infant mortality statistic, which would not be uncommon. I try to make sure I weave all that in because, again, a lot of our students don't have that perspective. They have not interacted with a black person at that extent ever. And so I'm like, okay, well, I'm glad I'm here to give that to you because you're going to get it, the full-fledged experience from me. But yeah, that's a huge question, and you will be amazed at the differences in response you get when you start to ask random people in your life, when did you have your first black teacher? You'll be amazed.
In episode 35, released on October 13, 2020, Rishan and Praja from Memories join us to talk about the importance of innovation in supporting caregivers of people living with dementia. In this clip, Rishan walks us through an exercise to contextualize the burden and the roller coaster of emotions caregivers often experience.
I'll ask everyone here to close their eyes, and everyone listening, feel free to do this with me, but close your eyes. It's 10 years down the line, and you're coming home from one of many stressful days that's become a commonplace in your life. You realize the time, quietly open the door. You've been out for at least 12 hours. You gently approach the kitchen and open the fridge door. Covered in saran wrap is a plate on the middle shelf at eye level with a note, "Eat at 1 p.m. Besides that, a second plate, "Eat at 7 p.m. Neither touched, neither consumed. As you approach your living room with heaviness beginning to set on you, you see the TV on, remote on the floor, and a puddle of yellow. Carpet stained, the odor is pungent. Today does not seem to have been a good day. You take off the TV and enter the hallway. Everyone's now on the same floor as you moved into a bungalow earlier this year for safety. First, you check on your daughter. The door is ajar, her light is on, but she's sound asleep. This is the first time you smiled all day. With a kiss on the forehead, you take off the light and close the door. But your father's door is wide open. Empty. You're too tired to panic, but you feel your heart racing. Praying for an easy solution, you approach the back of the house and feel a breeze. The patio door is open, and asleep on the chairs is your father in soiled pajamas. You feel relief, sadness, and pain all at once. The costs begin to pile up in your head. 1. Replace the carpet? Well, I'll need to work another shift. 2. I need to wake him, but he'll startle and wake up my daughter, perhaps. 3. He needs a bath, but I have to be at work in 6 hours. Do I have the energy to do this? It's all too much, but you realize it's not as much as what your father is living with. What he's living with is dementia, and as we mentioned earlier, every 3 seconds someone in the world develops dementia. To put that in today's context, in the 20 seconds it took for you to wash your hands, 6 families received a diagnosis that changed their lives forever.
Wow.
I think that is an example that is a little serious, but I think it does bring to play some of the different burdens and experiences that caregivers are facing.
In episode 41, released on December 1st, 2020, Tim Davis, a high school teacher, mental health advocate, and author of the book titled Tripolar, The Story of a Bipolar Triathlete, joins us to discuss his childhood trauma, struggles with addiction, and pathway to recovery. In this clip, Tim talks about how participating in triathlons, running, and meditation has served as an outlet for him to manage his bipolar diagnosis.
I have bipolar disorder and I am a triathlete. I just like the term tripolar. because for me, tripolar was, taking care of the mind, body, and spirit. Like I said, the disease of a threefold nature. So there's the trinity of working on those three things to kind of become a holistic person. And in triathlon, you swim, you bike, you run. So there's the trinity of those three disciplines, to complete one type of race. And so that's why I like the word tripolar, because I'm a bipolar triathlete. So yeah, and it just once I found triathlons, I really felt steady in my recovery. It was like this one more thing that I needed to do for self-care, so that I can really feel stable and lead a balanced life and a successful life. Because I've had many successes now and sobriety and in recovery since I found exercising in any form really to manage my bipolar also.
It's interesting to me how running has been just a common thread in your life from, even prior to, before having your bipolar diagnosis, before where you are in recovery now. And so what I noticed is that it seemed earlier on you were running from experiences, running from difficult emotions. But now I'm curious, what is your motivation? Do you feel that you're still running from something, or is it more so running towards a goal, for example?
Wow, it really depends on the day and my mood. Generally, I'm running towards goals because for me, when I train, if I don't have a race that I'm training for, I don't know what the point is to get out, put on my running shoes. So I've always have a busy race schedule. I finish one race and I'm already thinking about the next race. But I still, when I have painful things happen, like my brother died from alcoholism 2 years ago at age 32.
Sorry to hear that.
So sorry.
Yeah. And when he died, I couldn't get to a meeting, but I could go run. And the first chance I got, I love mountain running, trail running. I'm an ultra runner, and we have beautiful, Angeles National Forest and Gilbert Mountains. I took off running and I did like 31 miles, and all I brought was water. I didn't normally I bring like several Cliff Bars, and I just didn't even pack food, and I just ran and ran and ran. And I just felt so good to just get a long run in, that took several hours. And it's just, so it's like there's this group out here called Riot, which stands for Running as Our Therapy. And, sometimes
I love that.
Yeah. Sometimes when life's problems get me down, be it, stress at work or, a different, issue with, one of my 3 kids, because raising kids can be stressful, as we all know. I can go out for a run, and it doesn't have to be a 30-mile run. It could be a 3 or 5 mile run, a short run. And, I can't think of the problem or solution right there when I'm at home and I'm stressed out about it, but I can go out and run, and I can kind of clear my head, and I feel kind of like I hit this meditative state. And then I find the solution. And sometimes the solution is just have acceptance, or just be loving and tolerant, don't, it's just a lot of times I can go run and clear my head and figure out solutions to my problems, so.
That's powerful.
Yeah, and that brings me to what you said in chapter 25. You said something like, that your running days are numbered, and that your ultra running career has an expiration date.
Yeah.
And you said, but I'm glad that I found my tripolar way to deal with that too. So what are some other ways, coping strategies that you're going to adopt when you're not able to be as active of a runner one day?
Well, I've recently started kayaking, and I figured, I can do elliptical and spin classes, and when it comes to it, I'll find even more low impact sports like aqua aerobics or whatever, because I go to the gym when the gyms were open, I go to the gym, and some of my friends are in there because I have a lot of older friends. They're in there doing the aqua aerobics, and I'm just like, that's gonna be me one day when my body can't tolerate so much of the heavy pounding that running entails. And that's fine, and I figure I'll take up other hobbies. Maybe I'll write another book. I've started meditating more recently with another 12-step fellowship I'm going to. They highly recommend meditation. So I like sitting still for 5 or 10 minutes a day. Meditation is a practice, and I have a hard time sitting still. But if I can commit to 10 minutes, as this program suggests, I'm doing pretty good. I know some people do it for hours. I don't know how they do it. Maybe I'll get there one day.
In episode 45, released on December 22nd, 2020, Demi, Danielle, and Luam join us to talk about a report co-authored by Etio Public Health Consultants and the Public Health Insight. The report is titled The Urgent Need for a Systems Thinking Approach to Address Anti-Black Racism in Ontario, a call to action for decision makers and policymakers. This report highlights the ways in which the education system, social and economic system, justice system, and the healthcare system contribute to the disparities in Black communities in Ontario. In this clip, we emphasize some of the ways in which people can join the fight against anti-Black racism.
I think just, educate yourself on the systemic issues, i.e. read this report. Once you're empowered with the knowledge from this report, take some action. Reach out to your local government, reach out to your provincial government, and make yourself heard. Voice your concerns, right? Like, we need to kind of galvanize everyone to voice these concerns so that they can be taken seriously and so that we can, have a voice at the table to implement these changes, right? That's how other groups do it, and that's what we need to do as well. We need to come together as a community and really push to have our voices be heard. And it starts with educating yourself and understanding how these systems do oppress you as well, right? Because some people may not understand the inherent, biases, and I was not aware of the healthcare instances, and it took me aback when I was understanding that, through the educational process, a lot of the things that doctors learn when they're going through medical school is that there's, inherently racist teachings in terms of like how to treat patients. So things like that are very important for, I think, people to be knowledgeable about and then take that action.
I'll hop in next. Coming as a person of South Asian descent and obviously darker skin, my message would be to, even if you're not Black, be very aware of how your culture may be complicit in anti-Black racism. So what was really eye-opening to me in my culture was there was always this talk of being the model minority. People with lighter skin are favorable, you'll have more success in life, change your name, etc., etc. And there's a lot of parallels there. So be aware of it, educate yourself, educate individuals in your community, your older family members who may not be as educated. Read this report, and as Danielle said, reach out to the levers within the governance of your community or within your local area to advocate for these things that we mentioned in this report, because they are important, and we are all affected by them in some way.
Yeah, like a big thing is obviously so much work has been put into this. There are facts, backing all these things up. I guess a big difference with this one is, like we said, there are actionable steps to see, like someone mentioned earlier, see what step you can contribute to, see how you can bring or garner conversation about these steps, because in this day and age, being an ally looks like different things, but just figuring out what being a good ally looks like for you is a big aspect of this. And there are many areas we touched on, so definitely at least one should pertain to you, speak to you. So just trying to figure out which one that is and try and be a contributor to the change we're seeking or the progress we're trying to achieve.
I would call on institutions and systems to take greater accountability, to be more conscious of how their systems might be perpetuating racist ideologies or harming Black communities and other communities of color, Indigenous communities as well, and really dissecting the areas in which they find the flaws in their system and actually working towards rebuilding it. It's more than just identifying the problem. It's working towards a solution, and not working towards a solution alone, because there's so many community organizations, Black community organizations specifically, that can assist and aid in helping institutions to find viable solutions. And just bring in those community members to the table, ask them what their needs are and how they can make the most impactful change.
My call to action would be, the issue of racism is, I find it's, especially with, the current messaging that we see, it's often very closely connected with, the justice system. But I really encourage individuals from non-traditional fields such as public health, education, urban planning, whatever it is, to find how this issue fits in with your field, and I guess look to see how from that perspective you're able to contribute to the change, because we need to have innovative solutions. We need to have outside of the box I guess ideas and just thinkers to kind of really come together, because realistically racism is a whole of society issue, and we need to really just, as we talk about so much in public health, multi-sectoral, interdisciplinary, break down the barriers, break down the walls and silos, and just work together to tackle this problem, especially the individuals who or the fields who typically aren't brought into the discussion.
At an individual level, we're learning more about a lot of different terms, allyship, performance allyship, and this and that. And everyone knows that I'm not a big fan of a lot of different terminology, because it's a very monumental challenge that we have in front of us. And if you look too far ahead, you might get a little paralyzed about what you could do. So each one of us can kind of implement new ways of thinking in our life to kind of be aware, be more reflective of what the situation is. And small change is good too. You don't have to be on the front lines of a protest you don't need to show anyone. If you are doing the work, you don't need to prove it to anyone that you are doing the work. You could start small, like in your workplace. Maybe you notice that, hey boss, we don't have a lot of diversity in the workplace. It could be something small like that. You don't have to be on the front lines to change the world. So you can change the world by starting in your own workplace, your own communities, your own institutions, and then collectively those changes will have a big impact. In episode 46, released on December 29, 2020, our former classmates Sam and Janelle join us to reflect on our MPH journeys and what we've learned from an early career. In this clip, Sam and Janelle reflect on their MPH journey, areas of interest, and what they've learned from their early career.
Policy for sure, because that's where I started my thinking of going into public health, right? Because I started thinking upstream already. And that's where, my statement of intent towards the schools that I applied to was where can I go from here to communicate and to help lower the barriers to accessing health? So policy, yeah, of course. I'm in research right now. So epidemiology and biostats are integrated everywhere, So it's amazing. Yeah, exactly. And it's amazing to see how, what we've learned is put into play now that we are out in the world making a difference, right? So I think epidemiology, I did my internship at the Canadian Red Cross, and I think global health was also a big passion of mine, and is still a big passion of mine.
To be completely honest, I think I went into our program with a fairly narrow understanding of what public health entailed. As an undergrad student in food and nutrition, I was involved with a lot of health promotion volunteering, and I also had the opportunity to work as a student health promoter for a local community health center. And I guess in my mind, this was what public health was. Those people that make the PSAs, they go to schools and do talks, and they put up posters about healthy eating and exercising and that kind of thing. And it was something that I really enjoyed and really loved back in undergrad. So it's hey, I'm gonna do my master's in this. But like what everyone said, what I've kind of come to learn through our program is that, and also just seeing what has, transpired throughout this year and how COVID-19 has really flipped the world on its head in a way. We can see that public health is connected to all functions and sectors of society. And like LaShawn said, that's what I really love about this field as well. It's, we can see how all the areas of interest are so vast, but they're all interrelated. And I think there's a lot of potential to make huge strides in the health and well-being of communities if public health considerations are made a priority. Just upstream thinking, like Janelle said. Currently, I guess what I'm most interested in is the idea of isolation and how that impacts overall health. now that I'm fully immersed in long-term care, I'm really seeing these residents living day to day, separated from their loved ones, and then, in most situations, I guess, adding on a layer of cognitive decline where they can't necessarily remember the loved ones in their lives. From a dietitian's perspective, I certainly see that it has a negative effect on their intakes, and it leads to a rapid deterioration in their health as well. So definitely in the long-term care setting, I guess it's a really big struggle right now between managing the residents' safety from the very real threat of COVID on one hand, and then on the other still figuring out a way to provide care that's compassionate and conducive to their quality of life. So yeah, that's what's been on my mind lately in my area of interest.
I hope you enjoyed listening to us share some of our favorite moments, and I encourage you to check out episodes you might have missed. And just when you thought it couldn't get any better, we will be sharing some more exciting updates over the next few weeks as we look to continually create new and inspiring content just for you. Be sure to follow us on our social media and make sure you don't miss out on any surprises.